Today, breaking news, coronavirus in America. Here's what you need to know right now. Currently, there are roughly 20,000 coronavirus infections worldwide, with the death toll rising to over 425, even surpassing the SARS epidemic in China. Earlier this week, China saw its deadliest day as 65 deaths were reported in just 24 hours. The largest jump we've seen since this started. Still, the mortality rate from coronavirus is only 2% compared to the whopping 10% with SARS. But that could change. In the United States, there are 11 confirmed cases and several being investigated as we speak, leaving people worried that coronavirus could turn into a deadly pandemic. Panic, fear, and misinformation are being spread virally online even faster than the virus itself. So today, we're going to cut through all that noise to give you the very best and latest information from the front lines of the coronavirus in America. Let's start with breaking news exclusives with someone who is in quarantine right now. Jared Evans is a 27-year-old football player from New York who has played for the Wuhan Berserkers, that's the name of their football team, for the past 2 years. After getting out of Wuhan on this cargo plane, this is actually footage that he shot. Those are all passengers coming over with him, Americans being evacuated. Jared and the others finally arrived at March Air Reserve in Riverside County, California, to be quarantined. Here he is.
My name is Jared Evans. I'm currently at the base here being held and screened. As you can see, the dorms are behind me. People are being screened over there at this time. We are safe and we are sound and happy to be on American soil. So right now we are going through the process of going through our caseworker and getting screened. And of course, everybody still has their mask on. And it's a hectic time, but I know everybody is excited and ready to get through this.
So we're joining Jared right now. Jared, thank you for being with us. Take us back to when you were in Wuhan and first heard about the new coronavirus. Was it taken seriously at first?
But thank you. I appreciate you having me on the show. It was not taken seriously at all. The news came, very limited to us, and it was just going through our daily days. Everyone going to school, the people are going to work. And honestly, prior to that, it was just, beautiful Wuhan. But when the alert came out, that's when everyone started to really, really get into a panic mode.
So you were actually in the epicenter of the chaos, right in the middle, when they announced they were actually shutting down the cities. Now, just imagine everyone here. Imagine that your city is shut down. No one can come in or go out. What was that like for you?
Yes, it was truly scary. The city turned into complete chaos. People were honestly just panicking, getting masks, arguing, fighting, just to have enough supplies to last, this epidemic.
Yeah, the thin veneer of civilization begins to crack pretty quickly. Dr. Ian Lipkin, the renowned virus hunter, who is in China right now on the front lines, is sending me updates. And he said the people of China are rising to the daunting challenges before them. And in particular, healthcare workers are putting in 16 to 20-hour days. But I get why there's panic everywhere. So, Jared, you're holed up in your home for a week. You finally got some supplies, but you don't know what's going to happen. And then finally hear that the Americans, at least ones that we can get to, are going to be taken out by the government. How did it feel to know you were finally going home?
It honestly was a relief. It was a blessing to be chosen out of the 1,000+ Americans that are in Wuhan. As you know, it's still shut down to this day. So it was like a relief off my back, and I'm very grateful for the Department of State and the CDC doing their job.
Yeah, there are 60, 70 million people in that region, it's not just Wuhan, who are now being quarantined off. Jared, if I can ask, are you symptomatic at all? Fever, sore throat, the lung problems?
Not Dr. Oz. I'm not symptomatic, and no one here has actually showed any kind of symptoms either. So we're just ready to go home to our families.
But you still have to wait, I know, because it takes 14 days for this virus to actually show itself. So there could be people who are still going to get symptoms. So as you guys wait, how is it in quarantine? Is everyone being kept apart from each other? Are you afraid that someone else might infect you even though you think you're okay?
So, we're all still taking major precautions. When we're in groups, we're still wearing our masks. But we're forming a little community here. We're also getting checked daily, twice a day through our fevers. So we're doing everything we can to, stay safe.
So, Jared, since you're able to follow what's happening in the media, let's talk a little bit about some of the sentiments you have. I know that you feel strongly about some people arguing that folks of Asian descent shouldn't be allowed to interface with everybody else. This is actually an Asian problem. What do you want to say to those people?
Well, first off, America is a beautiful country, man, and it's a melting pot of all different ethnicity, and we have to understand that if it didn't happen in Asia, it could have happened anywhere else. And for people to be, xenophobic and racist towards, the Asian people is very wrong. I just want to tell everyone that they need to, come together as we are in this community, because there are Asian Americans here. So.
Jared, God bless you. I agree. I think the threat of this virus should bring us together and not split us apart. Now, since you're a beautiful person on the inside, let me talk a little bit about your outsides. I hear you're getting some strange requests about people wanting to keep you company in quarantine. Is that right?
Yes. Dr. Oz, as me and you are both good-looking people, so yeah, I've been getting some crazy requests in my DMs.
Well, stay safe.
I've gotten some things, man.
All right. Stay safe. God bless all the Americans in quarantine, and stay healthy.
Yes, sir. Thank you so much.
Coronavirus, just like the flu, is the most dangerous to the elderly and to the young. So imagine what it was like for Randy and Ping Stockstill from Rhode Island, who had their 2 kids, one of which is a 3-month-old baby. 3 months old, baby Maxwell. They were in China while visiting Ping's grandfather, the man who raised her, and they were able to get a flight out of China, but had to leave Ping's grandfather behind in order to get their children to safety. They join us now from their section of the quarantine camp. To both of you, how worried were you that your sons, you have 2 kids, an older son as well, would be exposed to the virus, especially with one of them only being 3 months old?
Hi there. So we were worried. It was a concern with the virus. Our main fear was actually being stuck in China for an extended period. The longer we were there, we were afraid that they would run out of food and other life necessities, like medical services and whatnot. So that's what prompted us to reach out to social media like Twitter, Facebook, Tiger Droppings, people that could help us reach out, family and friends, help raise awareness.
Ping, is your grandfather okay?
Yes, he is okay. He's doing great.
And were you worried about your 3-month-old being so young in an area where we know that there's a lot of virus and it's a pretty lethal virus for young children?
I wasn't actually as worried for a few reasons. Actually, toward the end, I was more inclined to stay. One, neither my older son and my younger son actually had any contact with anyone from Wuhan. And also, I was the only person who ever went to Wuhan, but I was clear after the 14-day incubation period. The only concern I had was, for a very small chance, if someone, if one of us gets sick, then there would be limited medical resources to care for us. That was my only concern.
That's a real concern. I mean, Randy, as an example, when you were going through the checkpoints in China, trying to get out, there was a concern that you actually had a fever, which would have been a big problem for you. What happened?
Well, being from Baton Rouge, Louisiana, I'm not very fond of cold weather. So the day that we set out for the airport, I was pretty bundled up, heavy winter jacket and a wool knit cap. So as we were going through one of the checkpoints, they checked all of our temperature via forehead scan. The first test was indeed failed because of my wool hat, and I was able to pass the second screening with no fever, and we were allowed to proceed toward Wuhan.
Oh, my goodness. What testing have you guys had? How about the kids? And do you have any results yet?
So the day that we arrived here, January 29th, we all submitted to 3 tests to CDC officials. Those were both a mouth and nose swab and also a blood test. And we're happy to report, at least for our family, that we have passed the swabs. So that means that there was no coronavirus active or there in our throats or nose at the time of testing.
Which is great news. The test that you're hearing about is a special CDC blood test. But even with a negative test, folks have to be quarantined for 14 days because unfortunately, this virus seems to take that long for symptoms to show and for the virus to express itself sometimes. So, Ping, what worries you about the perception people have of people like your family who are in quarantine?
So I want to mention that we received tremendous support and understanding from a lot of people, including our employers. But at the same time, there are comments coming from certain people, mainly online, saying things like, oh, if you went to China, you should stay there. And someone went as far to say, please shoot down that plane, the plane that carried us back here. So in a way, I feel like some people are treating us like the Walking Dead, perhaps.
Yeah, we want to say emphatically that we're not the Walking Dead. And after this extensive testing and monitoring through the 14-day quarantine, we will not be a risk to our respective communities upon return.
I also want to add a point. I truly hope that people in this great country will not connect this virus to a certain race, a certain group, or a certain country of origin.
Very well stated. And we certainly don't want to penalize people who are willing to travel around the world because we're all in this together. Family members of the Stockstill have created a GoFundMe to help them with the expenses they've had to contend with in order to get out of China. We're going to link to it from DrOz.com. When we come back, now that the number of confirmed cases of coronavirus here in the United States continue to climb, we're going to give you specific things that you need to know to keep your family safe. That's next.
Jessica Simpson is breaking her silence about years of addiction, sexual abuse, and family secrets. A dark side she kept hidden from her fans until now. Plus,
I didn't want to say, R. Kelly just beat me in the backseat of a car. Who's going to believe me? I had gotten so accustomed to having days where I'd go without food. I'm going to end up killing myself, or I'm going to kill him.
all new Oz.
That's coming up tomorrow. Today, more breaking news on the coronavirus in America. We're giving you what you need to know to keep your family safe. Many of us feel deep in our psyche that a deadly pandemic will one day just come and wipe us all out, right? It's happened through history. So when they start talking about a global public health emergency in the news, we can't help but think, is this the one? And then we immediately flick on the movie Contagion, right? We've all done it. It's human nature. But while this coronavirus is so far not deadly enough to hurt humanity in a big way, like in the movie, some of the scientists that movie was based on are hard at work figuring out how to contain it. And I've been in constant contact with the renowned virus hunter, Dr. Ian Lipkin. He's the epidemiologist that the movie Contagion is built around. He's over in China right now. He's been sending us crucial updates. And in his latest, he says this coronavirus has an uncanny ability to spread, and we all need to work together to contain it. So let's discuss how this virus is spread and how we can stop it. And again, this virus is believed to be zoonotic, which means it originated in an animal. These are the bad viruses that we worry about. A lot of them start in bats. Bats are mammals, they fly, but they're mammals. These bats have weird viruses in them that don't seem to bother them, and they bite rats. So bats bite rats, right? And they're not sure if it's a rat, but a small mammal, right, like this. And then this rat ends up in a wet market in China. Right? That's why people are concerned about these markets. People don't trust the food supply. They want live animals, but those live animals are walking petri dishes with viruses sometimes. And somewhere, we believe in this market, the virus jumps into humans. And that person became patient zero and could spread the virus to somebody else rather easily. A simple sneeze propels the virus particles into the air, right? And then they make their way from that sneeze, those particles up in the air, or you touch something that has a virus particle on it, you touch your mouth, and boom, the virus is inside of you, right? Then the virus gets into your lungs, which in some patients is a big problem because that virus, and remember, it's got little spikes on it, like a crown. That's why it's called coronavirus. Those spikes help it defend itself, but it helps burrow down into the lung tissue, right? And once they get into your lung tissue, the virus spreads to all of the lung, and then these little beautiful air sacs, tiny little air sacs in here, that this virus particle begins to fill up with fluid. It causes inflammation. And these beautiful sacs that usually are light and fluffy, they become heavy and bogged down. This is pneumonia. Makes it hard for your body to get oxygen, and that's why we're seeing so many deaths in China. But the good news is that the cases we've seen in the States all seem to be doing well. We're able to prevent these bad pneumonias with our aggressive treatment. So far, they've not proven deadly in this country. Now, infectious disease specialist and epidemiologist from NYU and Bellevue Hospital, Dr. Celine Gounder, joining us. How are you?
My pleasure.
Dr. Gounder is in the epicenter, potentially in New York as well. There are 3 patients suspected patients in your hospital who may have coronavirus. What precautions are being taken to protect you and the other patients in the hospital as well as the city?
So first of all, I just want to say, Dr. Oz, that it's such a privilege to work at a place like Bellevue, where the men and women who work there take such pride in rising to this kind of occasion, whether it was caring for a patient with Ebola in 2014 or caring for patients who may have coronavirus today. So at Bellevue, we have something called the Special Pathogens Unit, which is basically actually our old tuberculosis ward. And by the way, we still do have TB patients who we send there. And the way these rooms are set up, you have double doors to enter the room. When we go into the room, we put gowns, gloves, we put a mask on, and then we go into the room. So, that's what we call in our parlance, contact precautions, droplet precautions, and airborne precautions.
Let's get into some of the big decisions that are being made now that affect all of us. The first is the idea of travel bans, that we can quarantine parts of the world. Are they helping? Are they hurting? What are the issues around them?
So this really comes down to human psychology and fear and panic. So if I said we had an outbreak of coronavirus here in New York City, and by the way, none of you can leave the island of Manhattan now. You are stuck here for the next, month or months. Yeah. What would you do? Well, you and I might run to the hospital and try to pitch in, but a lot of people, the average person, you probably would try to jump in your car and drive out of Manhattan, right? So, some of those people might be incubating the virus, and then that is potentially spreading even further. Now, if I said to you, we have an outbreak of coronavirus here in New York City, if you have symptoms of cough, fever, shortness of breath, please come to the hospital. We want to help you. You're way more likely to come in and get care. And that's really the key to controlling a situation like this. We want you to trust us to do the right thing by you.
Well, the World Health Organization has advised against travel bans because people sneak away. There are 5 million people who left Wuhan before the travel ban. So how effective was it really? So come on over here. What are the biggest questions I'm getting asked these days about these masks? Who's got mask questions here? Half the audience, I bet. All right. So tell us, Dr. Gallon, the difference between these two masks. This is a typical surgical mask that we can all pick up, available everywhere. And these are special N95 masks.
So the way I think about this is a mask for somebody who's sick. This is a mask for a healthcare provider. Notice that I did not say a mask for a healthy person who's not taking care of patients. So if you're sick, these masks actually help trap, when you sneeze or cough or talk, you're spraying little bits of fluid into the air. And this actually traps that inside the mask so that it's not spreading into the wider environment. This mask is much tighter. So I don't know if you've ever been snorkeling or even, just think about having a pillow over your face. This is hard to breathe through. So this is really just for a healthcare provider.
So you don't need to buy these. Frankly, you can't find them now anyway because they're pretty much sold out. But Americans shouldn't be wearing these. This mask, I don't think it makes sense to wear it yet. The primary benefit is when you put your fingers on something where a virus is present and touch your nose, you won't contaminate yourself. We touch our fingers to our face 3,000 times a day. And this virus doesn't travel through the air that well. It travels because it's on tables or armrests or, everyone in the audience, you don't know who was there just before you, right? So that's really the bigger issue. So stop hoarding them. We actually need these masks, and they're not doing you much good anyway. Plus, you get sputum in them. You wear them all day long. You wear them for multiple days. That's not how they're supposed to be used. Dr. Gallon, thank you very much. Good luck with those patients. Hope they're okay. In this country, we generally have 50,000 flu deaths. This year, we'll probably have the same. So if you want an action step, my friends, get the flu shot, right? It makes sense. Did you get one?
I get one every year.
I got one. Do what the doctors, nurses do. In the meantime, wash your hands of all the panic. And wash your hands, actually. It's the do-it-yourself vaccine. So use those fingers that are clean. And be kind to each other, because in the words of the famous virus hunter Ian Lipkin, we are one world. Be sure to subscribe to my channel so you don't miss anything. And remember to check back often to see what's new.